Hello everyone. In this video we'll be discussing on the topic of etiology and the diagnosis in the clinical pictures of kidney tumors. So kidney tumors are the cancers that can be benign type or malignant type. And something about kidney. So kidneys are the organs. Kidney are organs that remove unnecessary substances and excess water from the blood and help to maintain the balance of electrolytes that can be sodium, potassium, calcium and other ions in the body. So this is the function of the kidney actually. Now what are kidney tumors? So the kidney tumors are actually renal cell carcinoma that accounts for approximately 4% of malignant neoplasm in adults. So out of all cancer, these cancer actually consist of 4%, including approx 90% of one primary kidney tumors. Renal cell carcinoma arise from renal cortex. This is the part of the kidney, and most common is clear cell and the papillary carcinomas. These are the most common. And other, for example, urothelial, and these are also called as transitional cell carcinoma of renal pelvis, and account for actually 8% of all kidney tumors. And we have Williams tumor. This is the most common tumor in the children. So these are some examples. Now kidney tumors of benign histological type include oncocytomas, angiomyolipomas, fibroids, lipomas, and lymphangiomas and hemangiomas. And first benign tumor we have oncocytoma. This can be detected on X-ray examination. Average age for this patients are 62 years, and most common sign they will have a side pain or on the abdomen, and hematuria can be seen, bulky formation. Clear. And second we have angiomyolipoma. They are rare benign tumor of the kidney. Due to fat content, they can be early diagnosed on the CT scan or MRI. Okay. And hemangiomas are the cancers of the blood vessels, and kidney hemangiomas are rare benign tumor and occur the blood vessels of the kidney and occur anywhere in the urinary tract. Size of the tumor usually less than 1 to 2 centimeters. So it can occur in anywhere in the urinary tract. Clear? So now malignant tumors of the kidney. We have the urothelial carcinomas that occur in all organs of urinary system, most often bladder. So this urothelial carcinomas actually occurs most often in bladder. Here, this much. And now what are the cancers like renal cell carcinoma? You can see this image here, renal cell carcinoma. So this is the image. You can see this now. These are the cortex areas. The cortex and the cortex, you can see this renal cell carcinoma. This is a normal kidney and the kidney with the renal cell carcinoma. Clear? And this is the Williams tumor, which I said, which can be found in children, most common. So this is the Williams tumor, which you can see in the patient with child in the children. And this is also an image for the kidney cancer. Clear? This much. Now what are accounts for about 5% is malignant tumors of kidney, accounts for 5% of cases of urothelial carcinoma. Now what is Williams tumor? These are nephroblastomas and malignant embryonic tumor originating from nephrogenic blastema. Histologically it mimics a developing kidney, and pathologically mainly occurs in children age of 3 to 4 years. 10 to 15% of Williams tumor are associated with syndromes and congenital anomalies, and 1 to 2% familial. Manifestations like clinical features of this are abdominal pain, hematuria, hypertension and anemia can be seen in these patients. Clear? Now renal cell carcinoma. So renal cell carcinoma exists as sporadic and hereditary forms, and in this we have light cell PKK is the most common histological type, accounting for approximately 70% of the all sporadic PKK. Okay, so what are the risk factors for this renal cell carcinomas? We have hypertension, who are addicted to tobacco, who have high weight, obesity, acquired any cystic disease, and professional exposure to any trichloroethylene, who are working in this environment. And most common familial syndrome, increased risk of RCC is Hippel-Lindau syndrome is the most common risk factor for RCC, that is renal cell carcinoma. Now what are the clinical picture for the patient with RCC? Now 50% of patients with RCC have no signs initially. No signs can be detected in the patient, but it can be detected accidentally on an imaging any test which has been done on the kidney or anywhere on the urinary tract, so in that case accidentally we can detect. So because there is no sign, so we don't know the cancer is there or not. So if patient comes for any other diagnosis, if in that case we do any imaging test like CT scan, MRI, X-ray, if we detect any cancer, so in that case we can found. Otherwise 50% of patients have no signs or symptoms. Now what are the clinical pictures for this? We have hematuria as the most common sign you will see in cancer, and that is renal cancer or renal cell carcinoma. Pain in the side and the fever. Okay. Now how is renal cell carcinoma and other kidney tumors diagnosed? How will do the diagnosis? We can do CT scan, ultrasound of abdominal cavity and kidneys. Other tests you can do is blood test, urine examination. We can see like hematuria, we can see RBCs, we can see biopsy is the confirmatory test we can do to detect any kidney cell by taking the biopsy of kidney or other urinary tract parts. We can check the serum calcium level, C-reactive proteins. We can do PET scans, X-ray can be used to detect. And other blood tests we can do like ESR levels, alkaline phosphate level, so that we can see in the blood test. So all this level can be checked to detect any kidney tumors. So this was your kidney tumors. Thank you.